Are you an RN or an NP student that's starting their psych rotation? Do you feel that you're not prepared? Well, you're in luck. In this video, I'm going to be going over 5 different tips to help you succeed while preparing for clinicals. So stay tuned. What's going on, everyone? It's the Psych Dude back again with another video. If you are new to this channel, let me formally introduce myself. I'm the Psych Dude. I'm a board-certified psychiatric mental health nurse practitioner, and in this channel, I go over several different subjects to educate the public about mental health, ways to improve your overall lifestyle, and tips and tricks regarding psychiatric nurse practitioner and future psychiatric nurse practitioners. I hope you guys truly enjoy this video on tips and tricks to help you succeed during your psych rotation. Also, don't forget to like and subscribe, and don't forget to add me on Instagram at the Psych Dude. Without further ado, let me go ahead and give you my tips and tricks. Welcome back, Psych Dude family. It's great seeing each and every one of you guys, and thank you for the continued support. So, your first day of clinicals in the psych rotation as either an RN or NP is probably coming up way too soon. And you're probably thinking to yourself, how do I even prepare for clinicals, especially without experience as either a provider or as an RN? And it's definitely nerve-wracking, especially when something so new and something that you haven't done before is coming up way too soon. And anything relatively new to people pretty much freak them out, right? So let's be truthful. As an RN student, you're probably thinking and freaked out by the fact that you're actually going to an inpatient psychiatric facility. You're probably thinking you're gonna see so many people in straitjackets and people jumping around, hitting the walls, hitting themselves. But let's be truthful, it's not going to be like that. So definitely take that stressful part of it out of the situation. But honestly, don't freak out. This is the best time to learn, especially within this environment. I'll be speaking to both RN students during their psych clinical rotations and to NP students during their first psych NP rotations, but all of these tips typically apply, and I'll do my best to distinguish between the two if it relates to RNs or if it relates to NPs. So here are my top 5 tips to know when going into your psych rotation as an RN student or as your first psych rotation as an NP student. So stay tuned. So tip number 1 is practicing interviewing people. I would recommend practicing interviewing people because it's something you have to do on a daily basis. And learning how to interview people, honestly, within psych is so fun. You get to learn so much information about someone, and you get to dive in deeper into what might be the problem at hand. And it may seem like a simple task at first because it's just conversing with people, but it's not, because you have to ask them so much information, and if you don't get that crucial information, then pretty much the whole interview may be shot. So imagine starting off as a brand new RN or NP student and you have to interview someone who's extremely emotional. By the time you finish, you've missed probably a lot of pertinent information. You're probably thrown off because you will try to console the patient as much as possible, and being a brand new RN student or a brand new NP student, you will try to best fit their needs, but you'll try to just comfort them, but you won't ask all of the questions, and by the time the amount of time you have passes by, you're probably missing a lot of information. So in this instance, you have to learn how to interview people, learn how to cut them off. Well, not necessarily cut them off, but you need to learn how to stop one thing before they start to progress into so many different things that aren't needed in your actual interview. Also, another reason why I say practice your interview is because you want to be able to portray some sort of confidence, and you want to be relaxed throughout the whole interview. If you're stumbling over your words or feeling anxious, you're going to probably make the patient anxious if they were already anxious. Or even worse, you probably make them think that you don't know what you're doing. Especially if you're stumbling on your words, don't even know which questions to ask, or feeling extremely shaky, they won't trust you. And for me, as a young person or someone that looks young, if I don't portray that confidence, like you know what I'm doing, everything goes out the window and I get scared, the patient gets scared, and they probably won't come back to you. So you definitely want to be able to portray that confidence and learn how to interview. So my tip is interview anyone around you. Interview your family members, interview your dog if you need to. You know, you just need to be able to ask those questions in a particular order and know what to expect if they respond in a different way. So I would recommend interviewing anyone you can, just to be able to feel comfortable, say the questions correctly, and not stumble when you might think that something else is happening or while you're consoling someone. So you'll have, even though you may have a list in front of you, you want to be able to have that in the back of your mind when asking these questions, because you never know what may come up. And if you're prepared and you memorize some of the questions and know which order you need to go through, then it'll definitely be helpful, especially when a curveball is thrown at you. And you never know, especially in psych, there are different things that might happen. If you are an NP student, make sure you understand the art form of interviewing and make sure you ask the right questions, because at the end of the day, if you don't ask the right questions, you may come up with a different diagnosis and you might be treating the wrong thing, because based on those diagnoses, the symptoms, you'll be treating with a certain type of medication. As an RN, you want to make sure you ask those right questions also. You want to see if they have suicidal ideation, homicidal ideation. You want to understand the MSC. In psych, the MSC is important. It's like our physical assessment, but we want to understand their thought process, their mental status. Interviewing is an art form. It's hard at first, but once you get used to it, it's going to get a little bit easier. And like I said earlier, is make sure you try to practice with anyone around you. You want to practice on your friends, you want to practice on your family, you want to practice on your sister, brother, anyone that's willing to listen or answer questions, because the more you get into it and the more you ask it, it's going to come up in your mind and you'll be able to ask those certain questions that are pertinent for your interview. So tip number 2, learn your basic medication and what they're used for. Plain and simple, know commonly used psychotropic medications. Know what their side effects are. You want to know their generic names and their brand names, because everyone uses it all the time. One person might say fluoxetine and one person might say Prozac, but you want to be able to understand that they're both the same medications and they're both used for similar things. You want to know what they're used for and what side effects to look for. So for NP students, you want to know the indications, you want to know the common side effects, you want to know the starting dose, you want to know the dosing range and the max dose. You want to be able to learn how they work, and you want to be able to explain to a patient how they work, because when you're starting someone on medications, they want to know exactly what they're starting, how it works, and side effects, because that's the biggest thing. If they don't know side effects and they experience a side effect without knowing, more than likely they're going to stop because they're thinking they're having an allergic reaction. And RN, you want to know just the basis of each medication. You want to know the side effects. It's pretty much that's all you need to know, because at the end of the day, you'll be able to figure out what medications they're on and look it up later on. Especially in clinicals, you have so much time to learn, or you can even ask the RN, but you want to know which medications, the basics of the medication, and what to look for. And if you know those things, then everything else you can look up afterwards. So don't be afraid. So tip number 3 is learn common diagnosis and their signs and symptoms. Don't learn the little intricate things that are barely used, barely diagnosis that are extremely hard to figure out. Just know the common diagnosis. You want to be familiar with each diagnosis and what it entails. No major depressive disorder, no generalized anxiety disorder, know the difference between bipolar 1 and bipolar 2, and know the different types of schizophrenia. Other than that, that's pretty much the basis of what you want to know, especially going into your first day of clinicals. NPs, make sure you learn the basic diagnostic criteria for each commonly diagnosed patient and diagnosis. I would start off with saying learn MDD, learn GAD, ADHD, bipolar 1, bipolar 2, schizophrenia. Learn mnemonics that will help you actually memorize what to ask and what to look for. For example, Siggy Caps is for MDD and Dig Fast is for mania. Also, learn time frames, because that's important, especially when it's going to differentiate between one diagnosis and the other. For you RN students, I would recommend learning the common diagnosis as well and learn what each of them entail. Learn how to define it and just the basic understanding of the diagnosis, because when you're looking up charts and you're looking up patients and their medication, you just want to have that firm diagnosis and knowledge base of that diagnosis, because if they're talking about schizophrenia and you have no idea what schizophrenia is, you're probably thinking, oh, they probably just hear voices or see things. But then there's other things like paranoia, stuff like that you want to understand. And if you don't understand that, then things might be going over your head. But just think of those things and learn the basics of it. And then also don't worry about like certain personality disorders. Yeah, you might see it in the chart and then look it up then, but don't worry about stressing about personality disorders, because honestly they're hard to diagnose, especially with someone that has many years of experience as RN. They might not necessarily know exactly what certain personality disorders a patient might have, so don't even worry about that. Just learn the common diagnosis and the common medications, especially within the self. So tip number 4 is bring a notebook and a pocket handbook. This is a huge tip for both RNs and NPs. Bring a notebook and write down things you actually want to do and want to learn. Write down your weaknesses and learn how to get stronger in them. And make sure you have that pocket handbook with you at all times, because you never know when an instance where a patient may ask you something and you're not going to know exactly how to answer them. But the beauty of it all is you're a student. You have an excuse. If they ask you a question you don't know, pull out your pocket handbook, read them what's going on, read it word by word, verbatim, and they're gonna be like, okay, and understand. And they're not gonna be mad or feel like their care is being hindered, because you told them exactly what they wanted to know, and you're a student. They probably were students at one point, so they know exactly what you're going through. And it's the beauty of it all, like I said, is they won't care. You're a student. Don't even worry about that. When they'll care is if you're a professional and not know exactly what to say, and you don't have that pocket handbook with you. Imagine just making an answer up, and then when they actually talk to a professional, like their psychiatrist, psychologist, their RN, and come up with a whole different answer compared to what you said, they're not going to believe you. So I recommend just keep that pocket handbook in your pocket, and then keep your notebook in your pocket to write down the question they might have asked, so you know for future to study up on it and actually read to them verbatim of what you see in your notebook, so they'll have that better understanding of what they're actually asking. So key is that you make sure you keep your notebook for writing down questions that you want to know, weaknesses so you can work on things that you don't know that you might have come across, and keeping that pocket handbook just in case something happens where you don't know the answer right away, and you can refer to something when you're actually doing what you're doing. So tip number 5, which you've all been waiting for, is ask questions. You want to be able to learn how to ask many questions, even if they're stupid questions. You want to ask, because at the end of the day, you're caring about patient safety, and you don't want to just do something and not know exactly why you're doing it, right? It's because you want to know the rationale of everything. You want to know like what you're doing, why you're doing this, things like that. And if it is a stupid question and you don't want to be super embarrassed, look it up beforehand. You have that pocket handbook, look it up, and then if you still don't understand why or what you're doing, then ask. Your preceptors know exactly what's going on, and they know that you're students, so they've been there at one point. They were students, they were asking probably stupid questions as well, and they won't feel bad when you ask those questions, okay? Also, you don't want to be one of those nurses that think they know everything and they know it all, and then they jeopardize the patient's life and this preceptor has to step in and intervene. Don't be one of those nursing students. Be a nursing student that's willing to ask, that are not afraid to ask, and ultimately save patients' lives, because that's what we're here to do. That's what we get paid to do, is save patients' lives, and patient safety is key. So tip for NP students is ask your preceptors why they like certain medications over another. There's so many medications out there with similar indications, but ask them why they chose that one and see their rationale why they prescribe that medication over the other one. For example, a patient might come in with generalized anxiety disorder. One person might prescribe Zoloft and one person might prescribe Lexapro. You want to know their rationale, because when you're doing it on your own, when you think of their rationale, you're probably going to want to choose that medication too, right? Until you learn other people's rationales and come up with your own rationale to why you like this medication over another. It's something simple, especially when you have multiple preceptors that you can ask, or psychiatrists. Ask all of these questions, because you want to know their mindset on why they're choosing one medication over another. because like I said, there's so many different medications with all of the same indications, and you don't know exactly which one to pick. So a lot of the times it's certain instances of just trial and error, but if you're able to reduce that trial and error by asking your preceptor or asking the psychiatrist about why one medication was chosen over the other, then you'll understand their thought process and be able to prescribe that medication right away instead of doing the trial and error. And same goes for RNs. You want to be able to understand the doctor's rationale on why they chose a certain medication over another, and you want to understand what's going on and why they're choosing it. So ask questions. Ask your RN, your preceptor, your clinical instructor. You want to ask everyone why they're doing certain things, and sometimes they might not have that answer, but if you ask the right person, they'll understand their rationale for why they chose the medication, why they chose the diagnosis, and why they chose a certain treatment plan for the patient. So don't be afraid to ask. Don't be afraid, because at the end of the day, you want to make sure that your patients are safe and that you're practicing safely. Well everyone, this concludes my video. Obviously there are a lot more tips out there, but I just wanted to give you 5 top tips that I've realized that might have been helpful going into my clinical rotation. I thought every single thing on my list is important to know, especially when trying to prepare for clinicals. The rest of the things you'll probably end up learning, so don't be afraid. Just make sure you try to absorb as much as possible. The first day is always the most nerve-wracking day because you don't know what to expect. But once you get into the swing of things, you'll know exactly what to look up and things you'll know to go into clinicals better the next time around. And also just keep on working hard. Don't stress about it. You're in a learning environment. You're there to learn. Yeah, it's a pass or fail class, but if they can see you progressing and you wanting to learn things like that, then it's going to be really hard to fail you. And you just want to learn as much as possible, soak up as much as possible, because we're students, or you're students, and at one point they were students too, so they're not going to feel as bad. So guys, I hope you guys truly enjoyed this video. I hope you truly understand things that in my perspective of why I like to give out tips and why I like to do certain things. At least you'll be prepared on knowing what to do prior to clinicals as an RN or clinicals as an NP, Psych NP student. Also, don't forget to like and subscribe and click the bell button to be notified when I do come out with my next video. At 1,000 subscribers, I'm going to be doing a giveaway. I want you guys to participate in this giveaway, so make sure you tell all of your friends about my channel, to subscribe to my channel. And at 1,000 subscribers, I'm going to be going ahead and doing that giveaway. It's something that I truly use on an everyday basis. I love using it as much as possible, especially when I'm stumped about a certain situation. And I used it as an NP student. This was probably the #1 book that I've used, and it's amazing. Oh, yes, it's a book, so definitely keep that in mind. Obviously, I'm going to try to do other raffles after this, but this is going to be my first big raffle, especially for all of you followers, subscribers. You first 1,000, whoever you are, I'm so thankful. That's why I'm going to be doing this huge giveaway. Alrighty guys, I hope you guys have a wonderful day, and stay tuned for my next video. Psych Dude's out. Bye!